I'm a board-certified internal medicine and obesity medicine physician, and here are my thoughts in regards to dietary supplements. So if you are a healthy, well-nourished individual, then your diet should be providing you with all your daily supplement needs. You don't really need to take anything extra. However, there are certain scenarios where if, for instance, your diet isn't adequate, or if you have some dietary restrictions, if you're vegan, you need B12 supplementation, or if you take no dairy at all, then maybe like vitamin D and calcium, or if you're in a state that requires extra supplementation. For instance, pregnant patients need folic acid supplement, but generally speaking, your diet should be providing you with all your daily supplements. Now, what are my thoughts about over-the-counter supplements? I think if you're healthy and if you are not on any medication, taking like a daily multivitamin or taking extra vitamins that you feel is beneficial for you over the counter isn't really gonna cause you any harm. Is it gonna give you any benefit? Most likely not. Like, a lot of people say that it's just going to be expensive, which is fine. If it makes you feel great, then I have really no objection. When I talk about supplements, I'm really talking about the B12, the vitamin C, vitamin D, all of iron, the multivitamin, calcium, etc. I'm not really talking about herbal supplements right now. Herbal supplements in itself have, I feel like those are a whole different discussion. They have a lot of side effects, especially if you are somebody on medications or do have a medical condition. So I think that's something that you and your healthcare provider would have to discuss. So TLDR, if you're a healthy individual and want to start a multivitamin or some of these vitamins from over the counter, or those hair and nail, etc., it really shouldn't be a big deal. Talk to your healthcare provider, especially if you're on any medications or do have a medical condition. Then any supplementation, I do recommend you talk to your doctor, because a lot of them interact with medications. Especially, like I said, herbal supplements, completely different scenario. A lot of them have side effects that you should discuss with your healthcare provider. And I can give you actually an example. I had a patient this month that came in with bleeding. This patient does have to be on blood thinners for a medical condition. Literally just prior to discharge, she asks me, can I resume my turmeric? And then I find out she takes a couple tablets of turmeric every single day. Turmeric's main side effect is it decreases risk of bleeding. So obviously at that point, I told her, please stop taking turmeric. But that's like an example that I can think of. And I really think